We keep talking about who can get a hair transplant, but the question is who cannot get a hair transplant? You asked who is not a candidate for hair transplant surgery. I'm going to categorize it into three different groups. The first group is medical conditions. You may lose hair because of a variety of different medical conditions, like iron deficiency anemia, or thyroid disease, like either hyperthyroidism or hypothyroidism could cause hair loss, or different hormonal imbalances like prolactinemia, that a certain hormone starts to be more available in your bloodstream. Most of these medical conditions are not candidates for hair transplant because if you treat the medical condition, the hair loss will get better. So that's the good news, right? You don't need a hair transplant surgeon. You just need to go to your primary doctor or internist, and they can diagnose and treat your condition, and your hair will come back. The other condition is autoimmune disorder. If you lose your hair because of your immune system is overreacting and acting against your hair follicles, you cannot get a hair transplant. If you do that, you may lose those hairs for the same mechanism. The new hair transplanted into the lesions that are losing hair because of the autoimmune situation may lose the new hair too. So the last category is when you have a skin condition that you're losing hair because of that. And the most common type of this skin condition is called cicatricial alopecia. Cicatricial alopecia is an umbrella term for a variety of different conditions that your skin starts reacting against your own hair follicles. And you usually lose your hair in a patchy situation or in a certain atypical type for a male pattern or female pattern hair loss. Those are not going to be treated with a hair transplant because for the same reason that you lost the original hair, you may lose the transplanted hair. But some of those conditions, some of these skin conditions could be improved, and when the situation is calmed down and you don't have the active disease, you might be able to get some benefit from some type of hair restorations. I hope you learn about who is not a candidate for a hair transplant. If you have more questions, put it in the comment section or follow us on social media.